Welcome to the final episode of our 3-part introductory series on the microbiome. I'm your host, Andrea Wien, and this is the Microbiome Report, powered by BIOHM Health. In episode 1, we looked at exactly what constitutes the microbiomes of our bodies. Episode 2 uncovered the truth on fungus, and episode 3 is all about biofilms and digestive plaque. Our resident expert and microbiome researcher, Dr. Mahmoud Ghannoum, is back to enlighten us on the power of biofilms. We talk about what they are, why they're such a mystery to people, and whether they can ever be helpful rather than harmful. If you're liking the show so far, don't forget to subscribe so you never miss an episode. Now let's get to it. We're back in the studio today with Dr. Ghannoum, and as promised, our episode on biofilms is here. I'm so excited. Thank you again for joining us.
It's my great pleasure.
You mentioned briefly in our episode on fungus a bit about what biofilms are. We didn't have too much time to get into them, so I'm very happy to dedicate this whole session to them. Tell us what biofilms are, how you started researching them, and why they're so important.
I'm really excited about biofilms. And a few years ago, again, usually what I do, I go to these meetings, and I don't go to meetings which talk about fungus, which is my field. I go and listen to what other people are talking. And few years ago, I went to a meeting, if I remember correctly, in Atlanta, and they were talking about biofilms. It was a new area. And again, I said, this could be very interesting. Because why? They were talking about biofilms being a community of organisms which come and they start to work together and they form as if they have a city. And within this city, they communicate together. And they are basically have the same services we have in a city. They need food, they need waste disposal. So that fascinated me. And with that, I came back to the lab and I say, I really need to look at these biofilms. And of course, what do? I look at Candida and we start to looking at the biofilm. But let me now tell you what is a biofilm. Biofilms, if you can imagine, let me give you examples also from outside medicine. For example, when you go to a marina, you see all these boats in the marina. And what do you see in the outside? You have this layer of algae and this slimy layer. Guess what? These are organisms, whether it's bacteria or fungus, that stick to the side of the hull of the ship. And then they start to produce sort of jello. That's why you see it slimy. And this jello, as if they are it's like you have M&M and you put these M&M inside these jello. So the M&M are the microorganism and the jello is what they produce to protect them.
So going back to the city analogy, it's similar to we need security. And so they're building this as a security around themselves.
You are absolutely right. And I tell you what security they have. When they live inside these biofilms, if you try to get rid of them with antibiotics, guess what? They are resistant to antibiotics. So not only they have all the services you have in a city, you also have an army to protect them because you cannot have usually drugs or antibiotics, for example, they will not be able to penetrate or break through this jello, and that's why the organisms are happy there and protected.
Can our immune system also not break through that jello?
We did a study and it showed that even our immune system have difficulty in penetrating this jello.
So some people use the word digestive plaque. Is that the same thing as a biofilm or do they differ?
It is digestive plaque. It's referring to a biofilm, but in our digestive tract, in our gut, for example. And the best example why we said digestive plaque is that it's like the plaque in our teeth. Every morning we have to brush and in the evening why to get rid of this plaque. This is a biofilm. This is the best, simplest example of biofilm. But instead of forming in our teeth, it's sticking to our gut lining.
And it is, I would assume, much more difficult. Is it the most difficult in the body to get rid of in terms of biofilms, or are there other biofilms in different places that are just as tough to eradicate?
Usually we have biofilms in the vagina, we have biofilm in the gut, we have biofilm in the oral cavity or in the mouth. The other place where you have a biofilm and it's difficult to get rid of, when people go to hospitals, for example, they put catheters to give them medicine or to give them food like nutrition for babies. And what happens, these organisms or bacteria and fungus, they come and stick to the catheter and they do exactly what they do in the ship where they secrete this jello and they protect themselves. And because of this, in hospital, we call catheter associated infection, and it is a biofilm. It's this, so that is very difficult to get rid of.
Are there any instances when biofilms are beneficial to us?
Yes, definitely. Like in the gut, for example, the good organisms like Lactobacillus, Bifidobacterium, they make biofilm, but it is thin biofilm. It is not aggressive biofilm. And that allows them to stick to the gut lining and protect it and also help other organisms. So yes, there are instances where biofilms are good.
So when we're thinking about busting up biofilms, is there a way in medicine or in supplementation to attack only the biofilms that are hiding the pathogenic bacteria and fungi? Or is it we have to attack all biofilm, eradicate the harmful organisms, and then replenish?
This is really very important question because a lot of people think about it. So one of the ways is you need to get probiotics that target the pathogenic organisms. And that's why, for example, in BIOHM, we came out and selected rationally which drugs will only inhibit biofilms formed by the pathogenic organisms. At the same time, what you are doing by taking this probiotic, you also are replenishing and helping the good organisms. So basically, you are doing two ways.
Killing two birds with one stone.
That's exactly true.
So it's interesting to me because the National Institute of Health has publicly said that biofilms account for 80% of microbial infections in the body, yet not many people have heard of them. Why is that?
Well, because it's scientific term, biofilm, people don't realize it. But I gave you a good example, people in hospitals. How many plastic material we put in our bodies? You have the catheters. Nowadays we have knee replacements. We put valves in our hearts. All of this plastic material is a place where organisms can come and stick or adhere. And that's why, because we are increasing the use of all of these indwelling catheters, for example, we are giving opportunity for the organisms to come and stick, and then they become resistant to antibacterial agents or antifungal agents, and then it becomes very difficult to get rid of them. And that's why they account for such a high percentage of infection.
And this is why we're also probably hearing more about them, because in the past, we didn't have all of these plastics or we didn't have all of these medicines that were allowing them to grow. And so now that we're having more of these things, we're having more biofilms. And so we have to pay attention to them.
Oh, absolutely. And in a way, it's the way we're practicing medicine is changing, and we are making people live longer. And because of this, we are having other issues which we didn't have before.
Can we prevent biofilms from forming in the first place, or is it just an inevitable part of our symbiosis with our microorganisms?
I think there are a lot of efforts and a lot of research have been spent to try to understand how to prevent biofilms. In fact, one of the research which I did is we wanted to prevent biofilms forming on catheter. And we were able to develop a drug which really now is in phase 3 clinical trials, where we were able to, if you put this solution in a catheter for 1 hour a night, you will prevent the formation of biofilms. So there are efforts, and there are other people, obviously. This is a very, very hot area where people are trying to find new ways to prevent biofilms. And I really hope we will be successful.
When we're thinking, this is a little bit of a switching gears, but when we're thinking about something like leaky gut, intestinal permeability, what role do biofilms, if any, play in that experience?
Leaky gut, usually, what you say, like organisms in the gut, they gain access to our bloodstream. So biofilms, especially when it is made of pathogenic organisms or organisms that are virulent, the bad ones, for example, what they do when they are forming the biofilm on the gut lining, they start to break down the gut lining and cause injury. And once you injure it, then you will have leaky gut. So definitely biofilms formed by bad organisms are a potential really damager, or they can damage the lining of our gut and therefore allow the organisms to go in, and thereby what we call leaky gut.
In that same way, then, could a good biofilm, one created by lactobacillus or bifidum bacteria, have the opposite effect, where it actually is creating a layer of protection for the gut?
Yes, it is true. And also, you find we published a paper. We found that the bad organisms in the gut, or the virulent one, what they do, they start changing their forms so that they can cause damage. As I said, like for example, they can secrete some enzymes which break down the lipids that cover our gut and the proteins, and then that will allow the leaky gut. Now, the good organisms, even though they make biofilm to protect you, but they don't have this virulent factor. Like, to make something cause disease, it has to have factors that allow it to do so. And we call it pathogenicity factor or virulence factor. These good organisms don't have that.
This might be a bit of a stretch then, but in that same vein, could autoimmune diseases like arthritis, rheumatoid arthritis, actually be caused by bacteria that have escaped the digestive tract and settled in the joints where the immune system is starting to attack it?
You know, the best example in this area is in streptococcus. Like when people develop streptococcus, at the end, you will find a lot of people start to develop arthritis and joint pain. So definitely there is a correlation between the two.
And you found that pathogenic bacteria in Crohn's patients can form a partnership with fungi that make this intestinal inflammation worse. Is this a byproduct of biofilms?
Yes. In our study, we showed that Candida, one of the species of Candida called Candida tropicalis, works with E. coli, which is a pathogenic bacteria, as well as Serratia marcescens, which is another pathogenic bacteria. They work together to form a biofilm and then start causing havoc inside there.
So aside from taking a product that busts up the biofilms, what are some good ways to prevent them through your diet and lifestyle? And if you do have them, aside from taking a product, what else can you do to ensure that they're not forming?
I think what we need to do, as we were talking about, is can we use a dietary approach or nutritional approach to try to address this? I mean, it's not everything can be dealt with a drug. It's good for us to start to have the right diet to address this imbalance we have. We need to exercise. We need to have also better, like, for example, other sort of lifestyle ways of less stress, sleeping a little bit. All of this will help you to really keep this balance and go on. So it's really a multitude of, or I'm hoping as we move forward, we are going to have preventative measure that will depend more on the way of life we live, what we eat, to balance this rather than always taking drugs or otherwise.
I would agree. And I think it makes sense to me that making sure you're going to the bathroom regularly so that these things aren't just sitting around having time to build the biofilms, right? If you're not stagnant in your digestive tract, so doing things like eating more fiber, increasing your vegetables, and getting your bowels moving seems like that would be a good way to keep this going.
Yes, I really agree. And there's something maybe later on we can talk about down the line. I'm thinking I have started the work and research to try to understand how we really can rebalance the gut through a diet, for example, and other approaches. But we can talk about that, I'm sure, in another occasion.
Dr. Ghannoum, always a pleasure. Thank you so much for coming in today. We will talk to you soon.
Thank you very much. It's a great pleasure to talk to you. Bye-bye.
Thanks so much for listening to part 3 of our 3-part series, Setting the Stage of the Microbiome. Next up, we're talking SIBO. Until next time.